Well, good afternoon, everyone. Thank you for joining us for our Friday, March 3rd Kupuna Caucus meeting. We are going to get started. I think Senator Moriwaki is somewhere, so she will be joining us shortly, but I will get us started. We have a full agenda today, so we're going to start with the update on Medicaid renewal process for providers. And we do have a representative from the Department of Human Services MedQuest division that is going to kick us off. So thank you for being here with us, Meredith, and for sharing information that will be pertinent to the Kupuna Caucus. So I'll turn it over to you.
Absolutely, and thank you so much for the invitation. Happy Aloha Friday, everyone. I'd like to also introduce my colleague, Puanani Crab Parker, who will be co-presenting, and I beg your patience just for a moment as I attempt to share screen.
And I just want to check with staff that they make sure they have the ability to do so. So hopefully
they should be able to, Rep.
Okay, very good.
Hopefully you're seeing my screen. I can't tell.
Not quite.
Try again. And Puanani, if I'm not able to, do you think you can share screen?
I'm going to try and get that up right now.
Thank you. Actually, I think I got it. I think I got it, Puanani. But folks can tell me if they're seeing it.
Yep. Something's starting to come up. Okay, here we go.
Yep, there we go.
Okay, let me see.
It's a little squished, but we can see something.
Let me see if I can do better.
There we go, much better.
All righty. All righty.
And you hit the press. Oh, there you go. There.
All right. Thank you so much, everybody. And I'm going to just jump right in because I know your time is precious and the agenda is full. I wanted to start by just giving you a background. So we're from MedQuest, as Representative Hashimoto said. And during the public health and the COVID-19 public health emergency, you know, our applications for MedQuest coverage just really grew. So I want to point out this green line is 2019 pre-COVID, what we would consider a normal volume of applications. And then you see this purple line in 2020, right around March when the impacts of COVID-19 hit our shores, this drastic uptick and increase in the need for coverage through MedQuest, so increase in applications in this purple line 2020. And then starting in 2021, you'll see a renormalization of the number of applications. And then in 2022 and so far in 2023, actually a decrease below the typical 2019 lines. And so why would our applications be going down? I will share because our enrollments are continue to be really high. So here we are in March of 2020 at 327,000 plus lives. And that was fairly steady, as you'll see, from January 2019 all the way through March 2020, up and down a little every month, but fairly steady. And then comes COVID. And with COVID came this requirement from the federal government for continuous coverage, meaning if you were covered by Medicaid in March of 2020 or became eligible for Medicaid after that, the Medicaid programs have been directed to continue to cover you throughout the pandemic. So for that reason, and because of the economic situation we experienced early on, we see this continuous growth in Medicaid participation from our population. So far, it's totaled a 43% increase in the number of people covered by Medicaid. That's about 1 in 3 people in the state of Hawaii. So a total of 466,000. These numbers were just updated on Monday of this week. So 466,000 plus lives covered. And then this is what it looks like county by county. and what those increases look like. So starting up here on Kauai, we've seen a 44% increase in participation in Medicaid over these past 3 years. They're covering a total of 27,000 Kauai residents. Here on Oahu, another 44% increase, and we're covering 284,433 lives. And then Maui County saw the largest proportional increase, 47% increase, totally covering 58,966 lives. And then Hawaii Island, 36% increase, covering 95,312 lives. So we wanted to paint that context for you before we introduce. So why are Meredith and Puanani telling us about all of the people on MedQuest? Well, you may have heard in the past, and even from us maybe in past meetings, that there's a I talked a little about the declaration of the public health emergency, and when the public health emergency ends, then we will start to redetermine people's eligibility, no longer continuously enroll them. But what happened is the rules of the road changed a little. So the breaking news here is that at the end of 2022, so just a couple of months ago, the Consolidated Appropriations Act 2023 was passed. And what this act did was basically say, hey, Medicaid programs, we know you've been tied to the public health emergency, but we're going to delink, we're going to decouple Medicaid coverage from the public health emergency. And we're just going to say that the continuous coverage, despite public health emergency status, will end at the end of March 2022. And that we will, the states have to begin to, you may have heard of it called unwinding, but we will start to basically restart our regular eligibility determinations. It's how we did business before COVID. So it's saying you don't have to continuously cover folks anymore. You may take the next 12 months, starting in April, to get through your entire caseload to redetermine everybody's eligibility over the period of that year, that 12-month period. So I just want to share some quick facts, and then we have a few details to go over. So beginning in April 2023, which is next month, and continuing, this is the key important thing, continuing all the way to March of 2024, our DHS MedQuest division will just begin in April, right, to review all Medicaid cases. And here's what is important to know. Every single Medicaid household is going to receive a letter in a few weeks in late March. And that letter is going to let them know, because it's 12 months, right? So people are going to want to know, okay, well, but when is my month? So we're going to send them a letter, everybody a letter in March saying, explaining all that's going on and saying, and by the way, your month is February of 2024, or your month is November of 2023. We're also encouraging everyone to understand that when their month comes up, they will be receiving a pink letter in a pink envelope in the mail. And we ask them to please pay attention to it. It's why we changed it to a pink envelope, to draw more attention, and pink paper. To please pay attention. If it requires a response, please respond. Also, if you no longer need MedQuest, we know a lot of people may have initially needed MedQuest because they lost their job, they no longer had access to employer-sponsored coverage, and maybe they've now become re-employed and have access to employer-sponsored coverage again. So they can just call us at any time. They don't have to wait. And just say, hey, thanks a lot. I don't need Medicaid anymore. Appreciate it. Aloha. And we're happy to do that for them. The big action item that people can take right now, and you can encourage all the folks you work with, is to make sure that we have everyone's updated contact information. So especially if they've moved, which a lot of people did over the pandemic. So make sure we have the current mailing address, phone number, email, any contact information is helpful so we know how to reach them when their month comes up. The easiest way to make that update is call the number on the back of their health plan card. We have 5 health plans. And so everybody has their own health plan card. Just call your health plan, update your contact information with them. And in turn, the health plans are sharing data files back with MedQuest with everybody's updated contact information. So that when we do send our memo, it's going to the best address possible. You people who have access to their accounts, they can also log in to medquest.hawaii.gov and update their information on their account directly. Ready? And now I'm going to turn it over to Puanani to walk us through the toolkit that's available on our website. So take it away, Puanani.
Okay, so we have consolidated all this information on the restart of our eligibility redeterminations, and it's at our website. It's https://medquest.hawaii.gov/stay well. Next slide, please. All right, so on this, we'll have the most up-to-date information, and we will continue updating it as more information becomes available. Our campaign that will be that has started is Stay Well, Stay Covered. Next slide, please. Again, we've had I'm sorry, could you go back one more time? One slide, sorry. And we've had this, if you look in the middle of this screen, we've had this important in red sort of banner up on our website for, I think, about a year now. I'm just encouraging people who do visit our website. Hey, if you know anybody who's had MedQuest, if you've had MedQuest, think you've had MedQuest, has it now, make sure to call us and update your contact information. Just check to make sure that we have your most current information. So this is also something we've been working with all of our community partners on for the last year as we are out and about doing outreach, getting back into the community, making sure that we're every touch that our community partners have with a Medicaid member, that we're making sure to confirm their contact information. All right, so this is our Stay Well, Stay Covered campaign. And this is the kind of the top page. And as you scroll down the page, you'll get to the FAQs. Now there's a bunch of tabs here, FAQs, everything you may want to know currently. There's our current press release. There's a video that we've put out over like the Christmas time period, which can be replayed here. And we have a toolkit, which is especially helpful for those community partners that we're having help us in this endeavor of communicating to our members statewide. And we have some good social media tools that they can use to help create their informational flyers, post on their websites and that type of thing. Stay well, stay covered. Have you moved? Please update your address today at Quest. If you have a new phone number, please update that and stay up to date. Just encouraging members and keeping that top of mind to please make sure to do that so we know where they are, how we can contact them, if the time comes that we need to speak with them or obtain any type of additional information from them. And then, of course, there's the letters and notices. So currently, we're going to be sending out a March letter to all of our member households, which is going to be informing them that we're going to be starting up our redeterminations. We have them currently posted in the 6 different translated languages that we currently do on our website, including English. So for those of you who may need these, Chinese, Chuukese, Ilocano, Korean, Marshallese, and Vietnamese, we have those translated currently in those 6 languages and English. And this is what the March letter is going to say. It is going to arrive in a white paper, in a white envelope. And then we're going to be explaining to them that we're going to be starting our redeterminations in April and that their specific coverage certification renewal month is going to be covered through this month and year. So for example, if this particular letter said, hey, your household is covered through July 2, 2023, then the next sentence here, you will receive a pink letter in the mail in June of 2023. So their letters for their household will indicate what their specific case will be, what their renewal month is, and it will tell them what month we are going to be letting them know when their renewal month is. We're going to be sending them then a pink letter in a pink envelope to let them know, one, if they're still eligible, or two, maybe we might need more information, and so to please contact us and provide us that information. Again, this March letter is going to be coming. I know a lot of people have heard about pink letters and pink envelopes so far, but the March letter is going to be in just plain paper, and we will be sending this letter out to all of our household members. We've also got a lot of our community partners statewide. We've provided them the link and the access to these letters as well. So that, I mean, and our website is public. So again, you can steer people towards our website to access this type of information. And we will be adding additional letters that we may be, template letters that we may be mailing out to members, and up-to-date information. So we encourage everyone to come back to this link often to see if there's new information. Next slide, please.
And I slid in a couple of slides just because I wanted to show you, this is the HawaiiShip.org. And I don't know if anybody from SHIP is on this Kupuna Caucus call today. But I love that. I was just looking at SHIP actually for my mother because she had a question about her Medicare plan. And I was trying to show her, you should go here and look. And I saw this, I was like, yay, the toolkit is working. SHIP has already added it to their website. I just love that. It's a great example of exactly what we hope people do is go to the toolkit on our MedQuest website, pull the graphics, and create the information that's relevant for your audience. So they have this in their blog post, and then I just clip the detail when you click on their blog post, what it says. I love the way the information is presented, really easy, really straightforward. So mahalo to the really kind people SHIP for doing that. We won't go through all these details only because I think it's too much and the time is limited, but we just have them as part of this presentation. But all of this verbiage is available on the website that Puanani just really talking through what is the emergency, how did it affect members, what the time frame is, what you can do to prepare, you know, how are we going to get the information, all the things that Puanani just covered so well. Where do you go? We didn't talk about this too much, but you know, the big question is, okay, we're going to look at cases again. So what happens if somebody's no longer eligible? The first, and they don't have any other insurance. The first thing we would do is say, hey, do you have a job? Do you have access to employer-sponsored coverage? Please go check with your employer to see if you have access to coverage there. And if you don't, if there's no employer-sponsored coverage, then really the best thing to do is refer people to healthcare.gov, where you can find a lot of affordable plans. For us here in the state of Hawaii, Kaiser and HMSA are both have plans available on healthcare.gov. So when they go there, they're shopping for plans that are familiar here locally with Kaiser and HMSA, and again, very affordable. So that would be because we want to make sure in all of this, people don't end up uninsured. And then what we're doing to reach members, we're doing as many meetings like this as possible, talking to so many community groups. And of course, as we noted, we'll be sending a letter to all Medicaid households in a few weeks. And also, we've done a movie theater, a little 15-second spot, and we've been interviewing on Hawaii Public Radio with Honolulu Star Advertiser, just doing our utmost to get the word out there. So mahalo to all of you here today for inviting us and having us join you. Again, key message, it's gonna take a full year. We're not gonna be following with all of this until April of 2024. So it's a long haul. Yes, it starts next month, but it also lasts for 12 months. So we're really gonna be keeping at it, and I'm hopeful that we'll be able to be welcomed back to talk with you again sometime during that 12-month period. And this is just a little bit more about that health insurance marketplace I was talking about that, and Puanani is our main contact with the marketplace, so she can maybe take 60 seconds to cover this.
Yeah, so a lot of people, you know, who haven't had or who don't have any health coverage are very concerned with the costs. Again, healthcare.gov is keeping in place their low cost and low premium plans through 2025. So we definitely encourage for people not to be timid or scared about shopping here. Again, it provides you your options, but in order to gather your options and really see what you may be eligible for, you would really sort of have to apply. You could get on there. They have a tool where you can go on and estimate, basically giving them sort of roundabout information and general information and come up with some sort of estimate. But really, if you're going to get sort of what your subsidies, what you may qualify for, and that type of thing, is to really, I encourage everyone to apply who isn't offered health coverage through their employer at healthcare.gov. Again, if they need personal assistance because they just can't seem to get through the process or they're having difficulty or questions, we also have local help. We have a community partnership, which is also on our website, and in the FAQs, the link to our community partner page. And we have partners that we work with statewide in every county. All of our federally qualified health centers are a part of this community partnership as well. So again, we do have people here in the islands that can help our residents if they're unable to get through the process on their own. But again, many of the plans are very affordable. Many of them are less than $10 a month. And again, it just depends on the individual or the family's household size and what their annual household income is as well, which is going to determine what their monthly premiums are, depending on what plan they choose. So again, healthcare.gov, and they can also call the 1-800 number that's on that page. Thanks.
Thank you, Meredith. Puanani. I see Donald has his hand up. Donald, do you want to unmute yourself? Donald?
Yes, Senator, can you hear me?
Yes, we can hear you.
Thank you for letting me speak. Thanks for the presentation. Besides the different languages for the people to fill out the forms and whatnot, I'm looking at the blind situation. Somebody wants in Braille or alternative format, large print, as well as is your website accessible for screen readers for the blind?
You know, I believe it is for the large font. We can always, when somebody requests a larger font, we can reprint the notice in larger font. I have to double check with our program on the Braille printing to see if we have access to that. And the specific question you have on the
You want me to put the, oh, sorry.
Oh,
Thank you.
sure. Thank you so much.
We have a question whether the slides you presented today would be available for people. And so if you could, I guess, and give us a link or something in the chat, people can then access it, but it's very helpful. Thank you so much, Meredith Puanani. Any other questions? So just wait for the mail.
If you folks have other meetings where you think, oh, I think it would be nice for my group to also hear this, Puanani and I, we're doing the road shows. We're happy to join you. Again, grateful to Senator Moriwaki for inviting us here today.
Thank you for coming. Maybe you could also in the chat put one contact that if people wanted to have you, I see some people from Kupuna Caucus, you know, some other organizations that are on today who may want you to come and speak to them, because I think it's very helpful to know ahead of time and sending the word out.
Thanks, Senator. I'd definitely love to be in touch with you guys. So put your information. This is Rick Tabor. I set up the programs for Kupuna Council. So yeah, please do that. Thank you, Senator. Appreciate it.
Any other questions? Okay, seeing none. Thank you so much, Bonani. Thank you, Meredith. Really appreciate your coming on short notice, but we had just heard about it, so it's really timely that all of our providers online and others hear about what's coming up. So thank you so much. Oh. Okay, so going back to Rep Hashimoto and I will go over bills unless there are any other questions. We're going to move on to where we are. This is almost the halfway mark. We have had all of our hearings and we ended our Ways and Means hearing today, and probably on your side, Rep Hashimoto, you folks finished too. So all of the bills are going to cross over next week. And so what I have, thanks Charles, putting up all the bills that are still alive, or the status of the bills, because some of the bills are dead. So what we could do is go over them, and there are a couple, 2 or 3 bills that are alive on both sides. So those are the ones we might want to focus on and get your feedback, whether and which ones might be missing something, or what we need to do when we hear the bills, either the Senate or the House, to make sure that we cover the bases. So going over what's on your screen share, if you can all see it, is the rent supplement program that we tried to get some funding. It's in another bill, and I don't know, Troy, do you remember what the bill number is? I know that there are other bills where housing, and Rep Hashimoto is the chair of the Housing in the House. Whether there are other bills that we have the rent supplement, yeah.
Yeah, so the only other bill that's still alive is the permanent supportive housing that includes vouchers for rent supplement. So that's one bill that's moving. And then I don't know if there's a Senate version of the Kupuna rent supplement.
I think we do have a bill going through. But it's not, for Kupuna, but it's for rent.
So I think what it was is that the House bill died, and so I think we're using the Senate as the vehicle, SB 898. But know that there's all kinds of supplement stuff moving. So
yeah,
we know that there needs to be some type of senior carve out. But so we'll need to figure out where the dust settles, but at least we have the Senate vehicle moving, and that'll get referred to my committee likely.
Okay, so this Senate Bill 898 is the one that's crossing over. So please follow it and support it in the House, because it is a housing, and probably will most likely go to Rep Hashimoto's committee. So you can testify there and make sure that it moves through the House. So the next bill, HB 649, is the SHIP, but the SHIP bill, although it died in the House, it survived Ways and Means today. So please follow it in the House and make sure the House supports it and gets it through. So this is the state health insurance assistance program. And it's for the 3 positions and appropriation. So it's alive and is crossing next week. There are 2 bills, our Care, Our Choice bills, and there's slight difference. And I'm going to turn it over to Rep Hashimoto. There's and it's the 5-day, 15-day. And Aubrey, maybe you might want to add your comments in.
Sure. Rep Hashimoto, shall I just jump in, or do you want to start?
Go ahead.
Okay. Well, thank you so much for having me speak today. We have been really gratified to see these bills moving through and being received with such majority of the votes. The main differences between the 2 bills, HB 650 actually has a typo in it. There's a 15-day and 5-day discrepancy. So if you're looking at the HB 650 HD1 that's on the Ledge website, it's in section 5C. And it refers to if it's waiving the waiting period, right? If the patient's not going to survive. The way the bill is currently written, it says if the patient won't survive 15 days, then the 5-day waiting period is waived. It should be 5 days, then the 5-day waiting period is waived. That was a mistake that was in our draft that we provided to Kupuna Caucus. So our apologies for that. And then the other difference has to do with the second item, the second amendment having to do with allowing advanced practice registered nurses with a psychiatric specialization to provide the mental health counseling portion of the law. In the Senate bill, it specifies psychiatric mental health nurse practitioners. And so really, for all intents and purposes, those two things are the same. But I think it's causing some confusion, perhaps. And I don't know that now's the time to go into what the finer point differences on those are. But the House bill is just slightly more permissive in that it allows certified nurse specialization as well. I've learned that specialization is kind of falling out of favor and it's sort of phasing out, and there's really not very many of them. So for all intents and purposes, an APRN with a psychiatric certification or specialization is the same thing as a psychiatric mental health nurse practitioner. So now that everyone's eyeballs are spinning. And then the only other difference is the amendment that Rep. Tarnas added in JHA, which with the clean effective date, which of course we love. So now they go to their floor votes on Tuesday, and we wait to see what's going to happen next. I don't know, Rep. Hashimoto, do you have anything to add?
Well, I think obviously it's harder to get it passed through the House. And so I think that's what I've expressed to the, a few folks. And so, I think even though the House version has a clean date, we can still make the amendments, but I think, and then we can deal with it just in one more vote in front of the House. I think some House members didn't even want to see it come back, but I think if there's language that is difficult that we cannot live with, then I think it is what it is. But I would rather just have one vote rather than another 3 sets of votes in 3 committees and 3 floor votes that I have to then shepherd through. But I think the senators know the conundrum that I'm in and the House is in. And so hopefully we will see that happen. But we'll see. I think we will see what happens on the floor, but I anticipate we can pass it out. There's probably going to be some discussion and some no votes from some members, but that is to be expected, at least on the House side. But I think we should have enough to pass it out.
Okay. Is there anything else that we've been really pleased with the robust testimony and support from just the general healthcare consumer public, as well as nurses and doctors, and the different nursing organizations and medical organizations. We will continue to make sure that those voices are heard. But other than that, we are, at your service. So.
Yeah, no, that's great. I think we should possibly have a conversation with the Senate Health Chair to make sure they're clear on what language we are okay with.
Okay.
Just in case they're willing to shepherd the House bill through and just insert the language. I now know what the position is, so I think the Senate version is clean, but I anticipate we're going to get another triple referral. So I doubt we want to. We're going to just have to figure out which one is going to be the vehicle.
Okay. if you would like, are you talking about having a meeting where we all participate, or that's something you're going to handle?
I think that's something you folks are gonna have a discussion with the health chair. Yeah.
Okay, okay.
And
Will
you're
do.
saying, Aubrey, you're saying that the House bill is fine, what came over to the Senate?
The House bill with the exception of that 15 days needing
So
to
we
be
just
changed to
changed that
5
to
days.
5
Yeah,
days.
it's a great, yeah, we would love it as is. We're also, oh, I'm sorry, I missed a critical, another amendment that was in 442. And that was just adding language to the effect that if a provider is going to waive the waiting period, it says they specifically need to ensure that there is no coercion happening. The reason we're not very concerned about this amendment is that the law already requires each provider to determine that there's no coercion. It's part of the mental health capability consultation. So it is very redundant to include that in there. We're okay if it has to stay in, but it's just one more layer that could conceivably scare away providers and even result in less access. It's my understanding that that was added in at the request of Hawaii Medical Association. However, Hawaii Medical Association's testimony, there was quite an uproar amongst its own member doctors who communicated with leadership at HMA. And so that testimony is not showing up anymore in any of the subsequent hearings. So we, ideally would love for that to come out, but if it can't, we're okay with it too, because it's already really in the law.
Okay, anyone with questions for Aubrey or any of us on this bill? I'm just going to look to see if there's anything here. I guess not. Okay, so let's move on. Thank you, Aubrey.
Thank you.
Okay, so the next, what do we have next? Next is okay, the inspection bills are dead. They didn't make it through. HB 652 and SB 902 are alive. This is the workforce development bills. And I don't see, I think is Caroline, you're there? So you see the difference. I don't know if Senator San Buenaventura is on, but part of the differences are, instead of a pilot, making it a center and calling it the Caregiver Workforce Support and Development Center. So have you looked at both bills, or anyone else on looking at both bills and seeing what they prefer as language?
Right.
They are a little different.
They are a little different. Oh, sorry, Senator.
Yeah, no, please.
Good afternoon, Hashimoto and everyone. This is Caroline Kadira with EOA. Yeah, there is House Bill 652 HD1 for workforce development and relating to caregivers, and HB 902 SD1. Yeah. Both alive. We briefly looked at them yesterday. We had a meeting. The intent pretty much is the same. I think it's just the wording. It's somewhat.
The House bill is it establishes the Workforce Support and Development Center, whereas the Senate bill has it as a pilot project. I mean, that's a major difference.
That would be the difference. I mean, this is something, if we're going to be building this and working on this, we would obviously want to continue it. We'd have to sustain it though with something. Because I mean, it would just make sense, because this would help both with the workforce issue and also to support caregivers. So, I mean, and I'm sorry, Senator, I'm probably not answering your question, but.
So is Marika, I see Marika on as well. Marika, you have any input on the two bills? Marika.
Hi, Senator. Sorry, I'm trying to find my mouse here.
Yeah. Have you looked at these two bills, SB 902 and HB 652?
We have been working with Caroline on this. And we have met to, I think we provided some input on what we could do to move this forward about providing staffing as well as supporting the intent of having a resource center for the Kupunas to go to. So I don't know about the care inspection.
Marika, I think you're looking at the bill above that. That was for something else. Those died. So the last
this is Senate Bill 902 and House Bill 652.
Okay, yes.
It's the
Yes.
workforce development bills.
right.
So that's the one we were working on, and I think it was 200,000, Caroline, correct?
Well, that was before we made an amendment to it, and what we did during Kupuna Caucus, I believe in January, or maybe it was February, is we combined two requests that were very similar. So that's what became House Bill 652 and Senate Bill 902, which took the components of the Workforce Support and Development Center along with the education and awareness concept and blended it together. So it is twofold or threefold, Senator, in that both bills are asking basically for three things. One is for project development. The other one is for developing the curriculum, and then the outreach and education. The outreach and education is just getting the word out that this is a line of work that you can get into to support Kupuna, which in turn supports caregivers. So those were the three sort of takeaways from these two bills.
Okay, well, the question is, which of these two? One is a pilot project, and the other is establishing within EOA the Workforce Development and Support Center. So there's either a pilot or it's permanent, the way I read it.
Though I would like it, because we'd have to come back to sustain it probably long term. So maybe the pilot, so that we can learn from the pilot and then work out from there, would probably make sense from a program standpoint.
Okay, so it's providing, if you did that, if you see anything in terms of what we should have in terms of education, training, recruitment, that's in 652, that doesn't seem to be in the Senate bill, in terms of developing a comprehensive statewide recruitment and retention campaign to encourage more residents to enter the healthcare workforce. So if you look at the Senate bill, I mean, I'm not getting in the weeds here, but I think you folks need to look at that and advise us. I know we've got a big group here, and I don't know if others can get to the two bills, but if you have any input at all in terms of what the needs in the community are for people who are trained in various of these areas that are in the two bills, please let us know as soon as possible.
We'll get back. We'll put both side by side. We did that yesterday, and we did see those three components in there on both. I just think it's the way it's worded, maybe a little different. And then, like you said, the difference between establishing and a pilot is the other difference.
Yeah, so if you could work together on that, and people, who have an interest in this and have needs in terms of workforce, and having a trained workforce in various areas should provide some input as well, so that as we tailor this and whatever comes out, we should have that in the bill.
Thank you, Senator. We'll do one more retake of it. We did it yesterday, but we'll look at it one more time. I didn't pick up the pilot and the established, so thank you for that.
So, yeah, and maybe you might touch bases with Maricar so that you guys are together on it too.
Yeah, thank you, Senator. Yeah, those three things, A, B, C, are added.
Yeah.
Okay. Rep. Hashimoto, did you have anything to add in terms of the workforce development bills?
No, I think you just got to let us know what exactly you need, and then I think Senator and I will have to figure out what is going to be the vehicle.
Okay.
Okay, so the next bill is House Bill 1486. And I think this is just the Kupuna Care Program. That's not a Kupuna Caucus bill. These bills now are Kupuna bills, but not the caucus bills as we go through these. So Caroline, you want to talk about this bill?
So House Bill 1486 HD1 is for Kupuna Care, and I'm sorry, excuse me, I have my chat box up. And that one, I believe that one's asking for an appropriation to make our budget whole, because we did take a slight decrease in our Kupuna Care program during the pandemic. And of course, those funds weren't restored. Once they're gone, right? So that's the 1.8 million that would make our budget whole back up to 9 million.
Okay. Questions, anyone? Okay, the next one is the hearing aids bill. I don't know, Rick, you want to say anything about that? But it is going through, and I think it was $1,500 per hearing aid. I don't know if I don't think it has all of the bells and whistles. But Rick, you wanna talk about that?
Well, I don't have too much of an update. It sounds like it's moving along, but there were some amendments, correct? So, and I don't know, Senator Joy Ventura, is she in here, or anybody from the deafblind task force on board with us? You guys may have more of an update. Let me see if yeah, so it's moving along, but with some changes.
Yeah.
That's all I can say to it.
I think it's I think it's 1,500 per
It's 1,500 per hearing aid per year, every 36 months is how it's written. It's the very same as it was the last time around. No changes. I know.
And I don't think there's language in there on the concern that we had last time, in terms of servicing.
They didn't do any of that. And there's no addressing that there's over-the-counter hearing aids available right now. None of that is included in this. But I have done quite a bit of research, as you know, and any insurance can say that they can cover hearing aids. The issue is, how much do they cover? Depends on how much you actually pay for your coverage. So I just, I'll reiterate that. So it's just moving along, I guess.
It is moving along, and it's going over to the House, so you might want to look at this and see what you can insert.
Absolutely, will do. Thank you.
Okay, the next is another EOA bill. This is I thought we did this last year, this caregiver support and Kupuna Care Services.
I can easily speak to that one. So Senate Bill 1372 and HB 1074, its companion, is our admin package measures, and that is just clarifying the definitions for Kupuna Care Services and what a caregiver is, and also for respite care. It's just cleaning up the language from the bill that we passed last year that combined both the Kupuna Caregiver Program with the Kupuna Care Program. So there were some tweaks we needed to make to that, and that's what those two measures are about.
So I don't think there's any difference, or correct me if I'm wrong, between the two bills, the one in the House and
I think they're the same. I'm just, yeah.
Okay, so whatever we see going over first and what we can do, one of them should be moving.
Mhm.
Okay.
So thank you.
And this last one is not our bill either, but it is establishing safe routes for people, especially Kupuna and the Keiki, and developing these safe routes. I think there's some it's an appropriation. Safe Routes to School program, special fund. So it's preventing the kind of fatal injuries that occur on the highways when people walk across the street, and with the elderly and with the keiki. So that is, oh wait, we've got one more pair. This is the Medicare Patrol. They're both alive in the House and in the Senate, and I think the bills are the same. Right, Caroline, or is anyone here from Patrol?
As far as the wording on both of those, I'd have to just double check, but yes, that, if memory serves, pretty identical to support our senior Medicare Patrol program.
And this is the 3 positions, and I think it was about a couple $100,000, right?
Right.
50 or something like that.
Something like that, yes.
Okay, any questions, anyone?
I have a question.
Oh, yes, Caroline.
How about House Bill 1075 and Senate Bill 1370, its companion 1373?
What is that
and
bill?
claiming, I thought one of them was moving, and I can't remember.
What is the bill number?
That one is our other admin measure. It's for the administrative claiming special
Well,
fund.
I thought I saw it coming out of WHAM. Wait, what is the
Yeah.
number, SB number?
1373.
Wait, hold on.
The Senate bill is still
Oh,
I
thank you,
think it's-
Christina.
Yeah, it is.
1372, I believe it is, or 73.
Oh,
Yeah.
I guess we missed that. Yeah, we did pass it out of WHAM, I think yesterday. It's 1373, did we? Yeah.
Okay, great.
Oh, we'll put that on our list, and we missed that on our list. This was. And there's no, the House bill, it's just the Senate bill. Charles,
It was referred to the Finance Committee, but the Finance Committee hasn't scheduled it yet, so,
Okay.
and it's kind of deadline already, so.
yeah. So the one bill to follow is Senate Bill 1373 in the House. Anything else we missed?
Yes, healthy aging. Sorry.
Healthy aging.
Watching your chats come up.
I think we passed that too. What is the
Yeah.
bill number on healthy aging?
Senate Bill 1853 and House Bill 872.
Charles, can you bring 18?
I think both passed. I think they passed houses.
Yeah. Yeah, they passed. That was the House. House passed it, and okay, the House passed it, but the Senate didn't. No, wait.
There were actually 3. I think the Senate Bill 853 was the one that passed.
Yes.
Wait, Charles, that's Senate Bill 853.
Yes.
1853 or 853?
853.
Oh, 85. Yeah. Healthy aging, right? 853.
We miss any others?
And then the House bill passed as well.
I believe so.
What is the health bill? Is House Bill what?
872.
872. Charles, can you try 872? Yeah. So both of these are alive.
Oh.
And healthy aging.
Sorry. 2 more.
Anything else?
Yes.
Ron, I thought we had
Okay.
an Alzheimer's one too.
Yeah, those
Yes.
2 for Alzheimer's.
Yes,
Yeah.
hey, Senator Moriwaki, Representative Hashimoto, everyone on the call. Thank you very much for your support yesterday at Alzheimer's Awareness Day. Very appreciative of everyone's support there in the legislature. Yeah, so two bills in the hopper, HB 278 and SB 163, both were successful in passing out. I do want to say that the difference is they're not companion measures. The difference is with HB 278, there is reference to a working group. But EOA as well as ourselves have testified for that language to be stricken out, given the fact that there already is a working group in place for the BOLD implementation grant that EOA has with from the federal government. So there is a focused public awareness effort within the BOLD grant to establish that working group. Aside from that, the only other difference is
What's the Senate bill number?
163 is on the Senate side.
160, okay. But this 595 isn't the bill, right? What is that? Companion didn't go. You have a different bill in the
Correct.
Senate.
Correct, Senator,
Okay,
correct.
okay, right.
And 163, the Senate bill, it appropriates across multiple fiscal periods is ideally what we prefer, I guess, from the Alzheimer's Association's perspective, given the fact that from a timing perspective and Caroline and her team is applying for the new round of BOLD implementation funding, the fiscal periods will overlap. So we're hoping an appropriation will made to be used across multiple fiscal periods, the next biennial.
Okay,
And Caroline, you can feel free to.
so is Senate Bill 163 is the preferred bill, but so we should be following that, and HB 278, if you struck the working with, would it be like SB 163, or you just prefer 163?
Striking out the working group in addition to adding, as far as the fiscal period, adding that the appropriation be appropriated for across multiple fiscal periods.
Mhm.
So that's lacking in the House version.
Okay, all right. Did we miss anything else? Thank you, Ron. Is that it? We want to make sure we don't miss anything else. Okay, very good. Well, we're coming up on the, oh, Donald has his hand up. Is that an old hand or is that a new hand?
Yeah,
Donald.
Senator Donald Sakamoto,
Uh-huh.
National Federation of Blind Citizens for a Fair Right. I just want to let you know and everybody that I reached out to the Senate and the House for the bills for mobility transportation. So SB 101 was for the Senate, which Senator Lorraine Inouye introduced. It passed the transportation, but didn't get a WHAM hearing. So I guess that one's not going through. But on the House side, HB 415, Chris Todd introduced as a chair to the transportation. It went to John Mizuno, Representative Chair of Human and Health Services, Health and Human Services, passed finance, and it's proceeding on. So I'd like to thank all three committees for passing that bill for HB 415, and look forward to going on the Senate side to have more discussion and to submit testimony. And Senator, I heard you on the Rick Amato show on Wednesday with Representative Gene Ward. And there was a discussion about HB 1336, the bail reform. I'm very concerned about elderly people, especially myself who is disabled blind. If this bill is passed and then criminals start to, take action against us and others who are vulnerable, I'm very concerned. Could we have a discussion on that for next meeting to have somebody present their opinion about the bill, who introduced it at the committee?
Okay, we will follow up and see if we can get that person to join us. And I know that there's opposition from a number of sectors, including the courts. If you look at the testimony on that bill.
It may not be alive by the time we next meet.
Yeah, well, hopefully.
Hopefully. I'm crossing my fingers.
Yeah, we will check on it, so we'll see.
Appreciate it. You sounded wonderful on the radio station.
Oh, hey, thank you.
Thank you.
Thank you. Is there anything else? Any other business? Rep. Hashimoto, you want to add anything?
No, I think we're at the halfway point. I think you need to keep watch. We're gonna have to figure out some of these vehicles. I think we were trying to move it on one side and not the other, and then I think we got into some problems and we tried to work out stuff. But we will try and keep things moving. So you know, on the House side, we have a limited amount of things we can move, and so we have to filter sometimes when we ask. And so I know Senator very good on the Senate side getting things on this side, and so at least we will have a whole nother chance for some of these.
I think we did pretty well. I mean, when you think about it, you know, when you look at what we have going forward.
Absolutely.
You know, so hopefully everybody on this call and then some will follow these bills. We will send you information, but make sure that you testify, and especially your organizations and individuals, because the committees do read the testimony, and the more you can give specific information as to why they're important, and if there's something with the bill you want to see changed, why you want it changed to make it a better bill, those are all welcome in our committees. So
I do want to recognize the members on my side that are here. So thank you to Rep. Cochran, Rep. Lamasao. I know Rep. Sayama was here for a little bit. Rep. Amato, thank you for being here. I think those are all the ones that I saw. So I appreciate them jumping on and supporting them.
I can't see. What do you see? I'm not good at this. Do you see any senators here that I can also
not see any senators, but
senators? Oh, where are the senators?
Yeah. All right.
Okay, very good. Well, thank you, everybody. Appreciate your coming by on a Friday afternoon.
Yep. Thank you, everyone. Have a
Okay,
great
thank
weekend.
you, everybody. All right, have a good weekend. Oh, happy Girls' Day.
Oh, yes.
Aloha.